Hello, I'm Dr. Anton Pozniak, President of the International AIDS Society, and I'd like to thank you for attending the COVID-19 conference. As we close, I'm pleased to present two new awards for outstanding abstracts submitted to our conference. The timeline between the onset of a global pandemic and announcing a call for abstracts was very short, making the caliber of science submitted to this conference all the more impressive. The first is the Young Investigator Award, which is presented to the highest scoring abstract submitted by an investigator under the age of 35. Abstracts in all 5 tracks were considered. The selected abstract is from track E, which focuses on social, economic, political and human rights impacts of the pandemic. It's titled Analysing Socio-Economic Perceptions in the Wake of the Pandemic Situation and was presented by Sheena Kapoor from IPE Global Limited in New Delhi, India. The second award is the Healthcare Heroes Memorial Award, given in honour of the healthcare workers who lost their lives caring for those affected by COVID-19. It's all too easy when delving into scientific discussions to forget that behind every statistic there is a person with a life, a family and a story. This award is given to the highest scoring abstract in track B, which focuses on clinical science, or track C, which focuses on epidemiology, prevention and vaccines. The selected abstract is from track B, titled Characteristics of Secondary Co-infections in Patients Admitted with COVID-19 at a New York City public hospital, presented by Vincent de Chavez from the Hospital Infectious Disease Unit in Elmhurst, United States. Please join me in congratulating the award recipients. And now there'll be a message from Secretary General of the United Nations António Guterres.
In many parts of the world, the coronavirus is colliding with the ongoing HIV epidemic. As the latest UNAIDS report shows, the HIV epidemic remains enormous, unfinished business. Millions of lives have been saved, particularly lives of women in Africa, and today 25.4 million people are on treatment. But gender inequalities, gender-based violence, and the criminalization and marginalization of vulnerable groups continue to drive HIV forward. The HIV movement teaches us that successful pandemic responses require a respect for human rights and gender equality, a commitment to leave no one behind, community-led service delivery, and innovation. The COVID-19 crisis is a wake-up call. Economies and societies must be reshaped to be fairer and more inclusive. Effective treatment and the future vaccine against the coronavirus must be available to everyone, everywhere, as a global public good, a people's vaccine. Above all, we need a recovery based on economic and social justice, since response gaps in pandemics, whether HIV or COVID-19, lie along the fault lines of inequality and political choices. Thank you for your commitment to these efforts and to advancing a better, healthier future for all.
Thank you again for taking part in a first-of-its-kind event. The dialogue began here today, grounded in evidence and in the spirit of sharing and analysing experiences from around the world, and it's just the first chapter. As we continue to pool brainpower, evidence and resources, I'm hopeful that we will crack the code of this pandemic. Thank you.